I'm not the man.
Is Deirdre taking the lead here?
Yeah. It's okay.
Yeah. I used to do it every year with my kids. We do. I just want you to say something and I haven't been camera for 10 minutes.
Mayor Stewart, you're first, looks like.
I am. I had no idea. All right, we're here. That's fine. Hi, everybody. How's it
Hello.
going?
Introducing
That's good. That's great.
Dr. McHale, after you, and then I'll come up and I'll take over from you.
Got it. Dan, how are you?
Good.
Good to see you.
I do. Thank you.
So, Air off the hook today. Todd's on vacation.
Yes, I know. Look out for him.
Good morning, everybody. Welcome to the great city of New Britain. Mayor Stewart here. Just want to welcome everybody today and thank everyone for being with us at Beacon Pharmacy, which has been a very valued partner with the city of New Britain in providing lots of wonderful healthcare options for our community. Beacon's been a place that really stepped up to the plate, especially during COVID, really modernizing the way that we provide medicine to our customers, their customers, and always being there to provide additional services for our public. They've been a great partner, and I know Senator Lopes and Representative Turco can attest to that as our representatives here with the city. So I'd like to turn it over to Dr. Mahalik, Dan from Beacon Pharmacy. Thank you.
Thank you, Mayor Stewart.
No problem.
Good morning, and thank you everyone for coming to Beacon Prescriptions in New Britain. My name, like Mayor Stewart said, is Daniel Michalak, and I'm the pharmacy manager here. I believe there is no better time and place to discuss how we can make healthcare more affordable. We have record high numbers of Americans unable to afford proper healthcare, and numbers continue to rise. Pharmacies like Beacon Prescriptions in New Britain are the most accessible form of healthcare and therefore play a vital role in a patient's health. Our patients and citizens of this state should not have to go without medications. They have tough choices between bills, food, and shelter. Medications should not be skipped due to financial struggles. Before handing it off to Dr. Gifford, I wanted to thank my staff and all healthcare workers for their hard work taking care of their patients. Thank you.
Thank you very much.
Thank you.
Good morning, Governor, Comptroller Scanlon, Madam Mayor, members of the legislature. I'm Deidre Gifford, the Executive Director of the Office of Health Strategy, and delighted to be here this morning to talk about the governor's proposals to tackle the high cost of health care. As you've heard, there is no more important issue facing residents and businesses of Connecticut than this one. What I'm going to do is walk through the governor's proposals a little bit and then introduce a number of speakers who are going to speak further about the impact of high healthcare costs on the residents of Connecticut and how the governor's proposals are going to help with that issue. So what is the problem we are trying to solve with these proposals? First of all, we know that businesses, local governments, families, and healthcare consumers are struggling to afford their health care. These high costs are stifling the growth and opportunity that's at the center of the governor's agenda. In 2022, there was a survey of residents of Connecticut, 1,300 residents, and over half reported that they had worries about the cost of health care within the last year. And nearly 4 in 5 of those who responded to the survey said that they were worried about affording health care now or in the future. A recent Gallup poll that was across the country cited the highest percentage ever of Americans who were avoiding health care, needed health care because of cost. Furthermore, we know that people of color and people with disabilities are disproportionately impacted by this affordability crisis. When we talk to businesses, both small and large, they regularly cite the cost of health care and wanting to provide their employees with high quality, affordable care as a top concern. The United States spends more than twice per person on health care than the rest of the developed world. And furthermore, our health outcomes are not as good as many other countries that spend far less. Medical debt is the #1 cause of personal bankruptcy in the United States. Think about that. Healthcare costs are driving people into bankruptcy with all of the disruption and the physical and emotional stress that goes along with it. We could go on listing how healthcare costs are impacting the residents of Connecticut, but all of you listening have probably experienced this yourselves or among your family and friends. Maybe you've been in line at the pharmacy, as I have been, and someone ahead of you was working with the pharmacist to figure out how they could afford their medication. Maybe you or a loved one have received a bill for a service that you thought was going to be covered by your health insurance. Or maybe you're just struggling to pay your premiums and copays for your routine medical care. The bottom line is that the status quo in healthcare costs is no longer acceptable. We must do everything we can to tackle this issue. The governor has called on all parties to do their part in solving this problem, and that includes insurers, that includes healthcare systems, that includes hospitals, other healthcare providers, drug manufacturers, pharmacy benefit managers, businesses, governments, and healthcare consumers. Everyone has a role to play in tackling this problem, and it will only be addressed if everyone works together to make healthcare in Connecticut more affordable. On February 3rd, the Office of Health Strategy, the Connecticut Insurance Department, and the Office of the Health Advocate, members of our Insurance and Real Estate Committee, brought together local and national experts to talk about solutions to this crisis. One consensus emerged, which is that there is no one solution or no one strategy that's going to solve such a complex issue. We need to tackle the problem from multiple angles. What's also clear is that the main drivers of increasing healthcare costs continue to be hospital inpatient charges, hospital outpatient charges, and the cost of drugs. We'll only be successful in tackling our long-term healthcare costs if we tackle those two issues. So, the governor has put forward 2 significant pieces of legislation that will make Connecticut a leader in controlling healthcare costs and continue to move Connecticut down the road to more affordable healthcare. First of all, he wants to support competition in the healthcare sector. Health system consolidation has led to some improvements in efficiency and coordination, but the evidence is clear that it's also led to price increases. Large healthcare systems increase their bargaining power with insurers and make it difficult to maintain reasonable prices. So to increase competition and make a more level playing field, SB 983 will ban contracting terms that allow healthcare monopolies to stifle competition and increase prices. He wants to enhance transparency so that insurers and providers and governments know about what the cost and quality of healthcare so they can make appropriate choices in their contracting and in their healthcare decisions. Connecticut has an advantage in transparency. We have our all-payer claims database, which has been in place for a number of years. We have our healthcare benchmarking initiative. And we have a well-established certificate of need program, which oversees a number of healthcare transactions. But HB 6669 would do more. It would enhance the oversight in the CON process. It would increase the transparency in something called the 340B drug purchasing program, which is an increasing purchasing program where we have little insight into how the profits are being used, and it's a program that was designed to provide more affordable drugs to low-income individuals and communities. SB 983, the anti-competitive contracting ban, would also prohibit gag clauses between insurers and providers that can prevent them from sharing important information about quality and cost. So by enhancing competition and enhancing transparency, we want doctors to be able to refer their patients to the highest quality, lowest cost site of care and not have contracting impediments to doing that. Governor wants to eliminate unnecessary fees. Right now we know that Hospital outpatient costs are one of the three main drivers of cost increases in Connecticut. And these facility fees that are charged by hospital systems at outpatient facilities that are not a hospital are adding as much as $400 million to our healthcare bills in the state of Connecticut. So we want to limit the facility fees to the hospital campus itself. When the market is not working, states can take action. SB 983 does this by addressing out-of-network costs. All of you have probably encountered a higher bill than you expected when you saw a provider that wasn't in network with your insurance company. I see people nodding. The governor's proposal would cap what could be charged from out-of-network hospital charges. This will work in two ways. One, it will lower the cost of those out-of-network services, and two, we think it will keep more providers in network so it's easier for you to find the provider that you and your primary care doctor want to see, and will lower overall costs. Finally, we want to help consumers with the high cost of drugs. HB 6669 would establish the ability for the Office of the State Comptroller to partner with other states to purchase drugs in bulk. That would and then provide a discount card to the residents of Connecticut who wanted one so that they could purchase drugs at less expensive prices. This bill would also require pharmaceutical sales representatives to be licensed, and their licensure fees through the Department of Public Health would provide additional education to prescribers about alternatives to high-cost drugs so that your prescriber knows not just the information, not just the information that he or she heard from a pharmaceutical representative, but also information about possible low-cost alternatives. So together, these proposals that the governor has made come at the high cost of health care from multiple different angles. For the benefit of our residents, we all need to work together to solve this problem. So this morning, you're going to hear from several individuals who are going to talk about the impact of high health care costs and on our proposed solutions. With that, it's my pleasure to speak next, our physician friend, Senator Saud Anwar.
Thank you. Thank you so much. Oh, thank you. Thank you, Dr. Gifford. Thank you, Governor, for your leadership and tackling one of the most complex issues that we have a responsibility to address. The bottom line is that the status quo is not sustainable. Here's the reality. As a physician, as a pulmonologist, every single day, I'm not saying occasionally, every single day I'm in the office, I see a patient who is not able to afford their medicines, their inhalers to help them breathe. So they actually ration their medicine so that they can survive but not thrive. They say, I just have to go to the restroom, I just have to go to pick my mail, I'm just going to take enough medicine just to be able to survive, to be able to do that. No one should have to make those choices. And then there are people in our state, people in our communities are making those choices every single day. And this is painful because they are not living up to their full potential. And these are systemic issues, and that would require for us to address the entire system and try to break it down so we can actually make sure that people in our state are able to have their full and complete life, achieve their full potential. And Governor Lamont, thank you for taking on that big, important responsibility. And I wanted to thank each and every one, my fellow legislators who are part of the effort. But we will have to do this, and because this is one of our promises, and we look forward to working on this. And I'm so honored to be currently the co-chair, Senate co-chair of the Public Health Committee, along with my co-chair, Representative Kristen McCarthy-Vahey. And we are going to look at this. This is also one of our priorities. Thank you.
Thank you, Senator, and thank you for reminding us about your co-chairmanship. That was my omission. So I'd like to introduce your co-chair, Representative Kristen McCarthy-Vahey. Thank you.
Thank you, Dr. Gifford, and thank you, Governor, for this effort. Earlier, Dr. Gifford, you talked about the fact that all stakeholders need to be a part of this effort, from hospital systems, pharmacy benefit managers, and you talked in the end about individuals. And I think building on what Senator Anwar said, individuals should not have to bear the primary responsibility and bear the brunt of the broken system that we have. And this effort and this proposal, these series of proposals before us, help us to address this from a systemic level. Every single one of us has a personal story. And I lost my father. I've talked about this many times this past year. My father was part of the VA healthcare system. So though we went through the grief of loss and the struggle of a debilitating disease, we didn't have to worry about the cost of care and the access to services that so many of our constituents and our neighbors and family and friends do. So I'm proud to be a part of this effort together with Senator Anwar and the governor, the comptroller's office, Dr. Giffords, to make sure that we are addressing this at every level, at every system level, so that, again, individuals are not the ones who carry the weight of this. Thank you.
Thank you, Representative. And I'm going to introduce our new state comptroller. Next, one of the things that's been a priority for Governor Lamont is for his state agencies and other constitutional offices to work together to tackle this problem. So I'm delighted to have the opportunity to work with Comptroller Scanlon and his really terrific team on tackling these issues, and he's going to speak a little bit more about their efforts on pharmacy costs. Comptroller.
Thank you. Thank you. Well, good morning, everybody. It's great to be here this morning. And like my friend, Representative McCarthy-Vey said, we all have a story. And I first learned that our healthcare system was broken in a pharmacy just like this one when I was a kid. My mom was a small business owner, a single parent. She never had health insurance and usually didn't go to the doctor, but if she got really sick, she would go, and she would go to the prescription counter and she would beg that pharmacist to see if there was a cheaper drug that she could get because she just couldn't afford the one. And I know that's a story, I see some of the people nodding over here, that's a story that they see every single day in this pharmacy and every pharmacy across the state of Connecticut. And what we're here today to discuss is what can we do to stop that from happening. Obviously, I think that there are a lot of solutions at the national level that I wish we could see happen. But because of the gridlock in Washington, it's up to states like Connecticut to act, and thankfully, the governor is acting. This team is acting, and because of that, we will lower drug prices for the people of Connecticut starting very soon. How can we do that? Well, first of all, my office, under the legislature that has been introduced by the governor, will be able to join a national consortium called Array RX. 3 states are currently in it right now, Oregon, Washington, and Nevada. Those states are saving their taxpayers and consumers millions of dollars per year by giving them a very simple thing, a drug discount card, so that when they come to a pharmacy like this, anywhere in Connecticut, from now on, with that card, they can make a decision as a consumer whether or not it's cheaper for them to use that card or their insurance card or pay cash. And what we've seen in these states that have this program right now is that there are hundreds of dollars of savings per visit to the pharmacy simply by basically having that card. For a thing like an EpiPen, something that my own family utilizes, $300 to $400 perhaps per pen that they get. It can be as little as $100 with an Array RX card in these 3 states. Connecticut will be the 4th state to use this if the legislature acts on this. But really, what is this all about? What this is about is the governor has put forward a patients first agenda to try to lower costs for people in this state. And as other speakers have said, there is not a business or a family or a person in Connecticut that is not worried about access to affordable care. And it is up to all of us, Democrats and Republicans, to stop with the things that have stopped these things from happening in the past, to take on the tough fights that we have to take on. And we are doing it with the governor's Patients First agenda. And I'm really proud to be working with him, with my former colleagues in the legislature, to make sure that we do everything we can to lower the cost of health care for people like my mom and the thousands and thousands of people across the state of Connecticut who are simply just fed up at the high cost of drugs. They can't afford it anymore, and they need the help that we can give them. One last thing I would say, it's not the topic of this conversation today, but the governor should be commended for, I think, the boldest thing that he did in his budget, which was the cancellation of medical debt. We have a state here right now where people are maybe 1 or 2 health scares away from being bankrupt, from being homeless. And that's not an exaggeration. This is a true reality that people in this city and across Connecticut are living in right now. And medical debt is getting so bad that over the weekend in the New York Times, there was an article that said that people are so afraid of it, they're no longer even going to the doctor because they're so afraid of collecting medical debt. If that's not an indictment of how messed up our healthcare system is in America, I don't know what is. We are taking steps, as I said earlier, in this state to make sure that while these problems aren't getting solved at the national level, we can solve them in Connecticut with Connecticut solutions. And I'm proud to be working with the governor each and every day to make healthcare more affordable in Connecticut, and I'm proud to stand with this team today. Thank you.
Thank you very much, Comptroller Scanlon. Now I'd like to introduce Reverend Robin Anderson, who has personal experience working with members of her congregation and others about the direct impact of high healthcare costs. And she's been a terrific source of information and input for us as we craft these proposals. And I'm happy to introduce her now, Reverend Robin Anderson.
Thank you, Commissioner. Thank you, Governor Lamont, and everyone that's gathered here on today. This is a great day that we are really talking about, not just talking about it, but we're actually making efforts. We're making strides to make insurance affordable, make health care affordable for each and every person here in Connecticut. So, Governor, I want to commend you for that. And it was a great pleasure to even be here to talk about the cancellation of medical debt. One of the things that I think is so important as I thought about even today and even yesterday, I have an appointment to go to a doctor. And so the doctor called me to confirm the appointment. And so they said to me, this is your balance that you have. Are you able to take care of your balance before you come in to your appointment? How many every day people deal with that? And when you don't have the money, you don't know where you're going to get the money, then you begin to compromise your health care. That should never, ever happen to anyone. And as I think about also people of color that die every day from diabetes, the complications of diabetes, heart conditions, and also asthma and all of those things, I think about also many of their stories is that I ran out of medication and I was not able to purchase the medication. Persons that I see in the hospital, that I go to see in the hospital, that have had aneurysms or have had complications with their diabetes. I said, well, what happened? Pastor, I could not get my medication. I could not afford my medication. And so because of that, they end up in the hospital with serious health conditions. And so we also know that people of color die at a higher rate than their counterparts. And so I'm so glad that we're looking at that and really being able to make a difference. I was talking to someone also that had a kidney disease. And this person has had her kidney disease for several years and actually had a kidney transplant. And her medication is $1,200 a month for all of the medication that she has. And each month I said, how do you do that? And she said, well, Pastor, part of it is that's why I got to come to you. And you and help us with help me to be able to pay for my medication, to be able to pick up my prescriptions. That should never happen. And if I don't take all of these medications, and she's on, if you ever saw a kidney transplant person, they're on about at least 50 or 60 pills a day. And so can you imagine not, wondering each month, how am I going to get the medication that I need so that I'm able to live and keep my kidney? And that's one of the things that kidney transplant persons do. And then I also think about even my own story. I've been in a position in which I didn't have also health care at all. And also that I had 20 pills that I had to take a day because I had an eye disease and my eyes kept hemorrhaging. And so I could not afford the prescription medication, and I was going around to different people, different family members, to actually help me with that, with the medication. And then finally, I was able to get into a protocol at NIH so that my medication would be covered. That does not happen for everybody and other persons. So each and every day, I hear people saying, I'm supposed to get a raise on my job, but I'm scared, Pastor. I'm scared about getting a raise on my job because that means that I'm going to get cut off my health insurance because I'm not going to be able to meet the income level anymore, that my income level is going to go higher than where I need to go. So how do I just tell my boss I don't want a raise? Well, everybody knows, do you make those kind of decisions every day? Everybody needs a raise. Everybody needs a boost in their income. But can you imagine making that decision because of the fact that you want to be able to keep your health care? And then also persons every day that are making decisions in terms of their health care and their premiums. Do I pay my premiums? Do I feed my children? You know, all of those kinds of things. These are things that people make those decisions. And a lot of our seniors also, most pastors will tell you and churches will tell you, each month we're helping many of our seniors to pay for the co-pays so that they're able to pick up their medication. So again, I thank you, Governor, for really looking at and making some decisions, and also going forward in terms of looking at how is it that we can really make health care affordable. How is it that no person in Connecticut should have to make a decision on whether or not they eat or they can pay their health care, whether or not they get a raise because they might lose their health care, whether or not they feed their children or pay the premium. That should never be a decision of anyone. And that when we see people die each year, and the number of people that die each year, how can we also, even as residents, as people, as senators, as representatives, and even governors, think about the fact, is it something that we could do? Was that a person that wasn't able to afford their medication? Was that a person that made a decision that they could not afford to go to the doctor? So I am so happy to be here on today and to represent and to be the voice for those that may not be here, that affordable health care, everyone deserves affordable health care. Everyone deserves to be able to pick up their medication that they need to keep them alive and to keep them healthy. So again, thank you, Governor. And also with the medical debt, that is long overdue. Many of our people cannot even, their credit reports, especially people of color, are disastrous, and they can't even lift up their credit reports because of the medical debt that's on their credit report, and also has also taken away from them being able to buy houses and buy homes also. We all deserve a good quality of life. And so I pray, I continue to implore that we all continue to come together and make health care affordable, and to help Connecticut to be a healthy place to live. Thank you so much.
Amen.
Thank you, Reverend, for those very moving examples and words, and for the work that you do to help Connecticut residents afford their health care. Next, I'd like to introduce Susan Millerick to talk about the patient perspective. Susan works with us on our healthcare benchmark committee and is an advocate for patients and their healthcare needs. Thank you for being here, Susan.
I'll keep this very brief. I'm a mom. I've been sometimes privately insured. I've been sometimes personally insured. I've been sometimes uninsured. I'm really pretty much an average Connecticut resident. You know, I work, I pay my bills, I do the things I need to do. It's out of control. It's completely out of control where we have gotten to with healthcare costs. And I'm so tired of being told that patients are at the center of everything everybody does, because unless we've got a $ target on our bodies, that's the only thing that we're the center of. And I don't mean that as in terms of the individual care we receive from people like you behind the booth, but I'm talking about when the bills come in. And you're getting, for a son to go for 15 minutes to see a dermatologist for a skin condition, and you get a $950 bill, half of which is a facility fee for an outpatient center where he just went to go see his doctor. 500 physician services. She didn't even touch him. That was part of the surgical services that were added to this bill. Same room, same time, 15 minutes, $935. And guess what? Our insurance covered some of it, allowed none of it, allowed some of it, but didn't cover any of it because we hadn't met our deductible. So when it was all said and done, $300 later, I'm out of pocket. That's a lot of money, especially when you're self-employed. It's a lot of money. And it's not fair. And it would be really fun if we could lock them all in a room and make them duke it out. The pharmaceuticals, the hospitals, the doctors, the labs, the insurers, you name it. We need to be at the center of all of this, and we are not. And if you didn't hear what the Reverend said, and that wasn't clear, you're not paying attention to what is going on in this country. So I'm very grateful to this administration, to Dr. Gifford, to Governor Lamont, to the comptroller, because somebody has to have the courage to bring everybody together and make this stop. This has to end for real people now. Thank you.
Thank you very much, Susan. And now for another patient perspective, I'd like to introduce Zach Campbell from Tolland, Connecticut.
Thanks to the governor and everyone else for inviting me to speak today. My name is Zach Campbell. I'm actually a Hartford resident. That's not your fault, I don't think. It happens. You know, I look like I came from Tolland. No, but in seriousness, some here may know me as an activist and an organizer, but today I'm here as a patient. I'm here as one of 6 in 10 adults in this country with a chronic illness who depend on increasingly expensive medication and ever-worsening insurance to survive. Less than 2 years ago, my doctor and friend, Dr. Saud Wanmar, here with us today, kindly made a priority of seeing me to test my breathing. I was using rescue inhalers every day and frequently finding myself in urgent cares and emergency rooms just to get by. With his help, I was diagnosed with severe asthma. I was told that I was breathing at 60% capacity on a normal day, and if I didn't do something about it, it could be the thing that kills me one day. On top of that, he scheduled me for additional tests that identified dozens of allergies that were spiking my white blood cell count, leading to additional chronic conditions. Ever since then, I've continued to be blessed by his support as we found medications that have worked and repeatedly fought with insurers that want to force me into things that don't work because they're cheaper or because of pharmaceutical deals. And when I've been told my meds would no longer be covered, I found myself against a wall. Pharma costs in the thousands, something I certainly cannot afford. As shocking as that can be, I grew up knowing that this is how our healthcare system works. With an autistic sister and another with epilepsy, my mother was in a never-ending storm of medical battles. We experienced multiple bankruptcies in my childhood, but my parents did their best to hide that from us as kids. It's no secret that healthcare costs are outrageous, across Connecticut and across the nation. Every day, people avoid setting appointments, skip medications, and miss preventative care. I hear it all the time. Ordinary working people are so scared of medical costs, they don't have the time to feel scared of illness itself. The cost of healthcare, the surprise bills, the insurance fights, random changes in coverage, the stress, the debt, is a health crisis in and of itself. When you want to understand a problem as baffling as this, the first question must always be, who benefits from the way things are? In other words, who profits? At the hands of profiteers, from privatized insurance to big pharma to for-profit hospitals, patients are nickeled and dimed to literal death in a labyrinth that has been engineered to keep us trapped. That labyrinth is guarded by an army of lobbyists paid to prevent elected officials from taking the action we need. You'll hear those lobbyists bend over backward to call billions in profit taken from the pockets of hardworking Americans a source of innovation and other such euphemisms. It's a bad joke. Look at Moderna. Now they're floating charges of $130 for much-needed COVID vaccines. Those are vaccines whose development was funded by everyday Americans through our tax dollars. They cost just $2.85 to produce. Meanwhile, Moderna's CEO became a billionaire overnight, now worth $6.2 billion. Healthcare is as basic a human right as there is. It's the embodiment of life, liberty, and the pursuit of happiness. That right is denied each and every day by unrelenting greed and corruption. That greed comes between the patients and the good doctors, nurses, pharmacists, and other healthcare workers who just want to do their jobs and take care of people. Governor Lamont's proposals aren't a quick fix to all of that, but they are a step in the right direction. It's a step in a miles-long journey, but every step saves lives in more ways than one. And is not the point? It's time for the legislature to take action on the governor's proposals and to lead by doing even more. Thank you.
Thank you, Zach. And now I'd like to introduce Nathan Tinker, the CEO of the Connecticut Pharmacists Association.
Right back. Snuck up on you. Thank you, Dr. Gifford. Thank you, Governor Lamont, for being here. It is very appropriate that we are having this meeting in a community pharmacist and independent pharmacy because this is where the pharmacists talk to the patients. This is where patients show up and get a bill that they did not expect. And we need to talk about the way all of this works in the larger context. And we've heard a lot about this already, but the pharmacists are the one who have to have that conversation and that counsel with the patient and tell them, I'm sorry, using mics again. I'm sorry, but your insurance only covers X amount and the other has to come out of your pocket, or other ways to go about that. And often, they're actually reimbursed by the PBMs and insurance companies for less than it cost them to buy that drug in the first place and provide it to the patient. So there's a lot of issue here from that standpoint. But part of this, too, is that pharmacists are by far the most accessible point of health care access for virtually every community. 95% of Connecticut folks live within 5 miles of a pharmacy. They see their pharmacist and are in the shop 20 to 30 times a year, as opposed to seeing a doctor perhaps 2 to 5 times a year. So the more that we can have that level of access take place at the pharmacy and provide that access and ability for the pharmacist to provide those services, we'll be able to help drive down those costs. So Connecticut's pharmacists are really, really ready to help on this process, bring those costs down, and make sure that Connecticut's residents are getting the access and equity for the health care they need.
Thank you very much. And now it's my pleasure to introduce the person who's leading the charge on healthcare affordability, Governor Ned Lamont.
Thank you. Anybody else like to talk? Look, I appreciate the comments on medical debt and what that means in terms of personal bankruptcy. I appreciate all the legislature's doing in terms of subsidies and keeping covered Connecticut available for working families, no out-of-pocket. I appreciate the concerns I've heard about folks that can't afford to take the basic precautions, get that test, take that the pharmaceuticals you need to keep you safe. And an ounce of prevention is worth a pound of cure, and we're making a terrible mistake in this country by forcing people to make those choices. I feel the sense that I've heard here today, and I hear every day, that the system is broken. And what we can do at a state level, while we wait for the federal government and wait for them to make sure that universal affordable health care is a basic right for everybody, it's got to start in Washington, D.C. So here in Connecticut, I want to do everything I can to deal with the underlying health care costs. I want to make sure that all the pharmacists here at Beacon have all the tools you need to make sure that I can get the right prescription at the best value for folks. That's in part what this discount card is. When Sean Scanlon teams with other states around the country, allows us to purchase pharmaceuticals at a lot less cost, be able to pass along those savings to you. Sir, you'll have a discount card right there. You'll be able to know that you're able to get the very best healthcare, very best pharmaceuticals at the best value there is. I don't want anybody standing between my pharmacist and the patient, and I don't want anybody standing between me and my doctor, be it Dr. Kildare or Dr. Anwar. I want to be able to trust my primary care physician. I want to make sure that that physician does not have any restrictions in terms of where they direct me to go to get the next level of attention I need. There's some contracting things and limitations and steering where sometimes people don't direct me to the places where I know I will get the very best value. And very best value starts with quality and also cost. And that's what this bill is all about, making sure that nobody stands between you and your doctor, making sure your doctor has the opportunity to direct you to where you get the very best value. Sean Scanlon's doing that right now with state employees, giving folks an incentive to go to places where they get the very best value. I'd like to extend that to everybody in the state of Connecticut, and this is just a start. Thanks, everybody.
We'll do on topics and then we'll let people leave and then you can do off topics.
Can someone comment, originally you had mentioned that one of the things of the problems is that some of the hospitals are charging fees, right, when you're at an outpatient, is that like at an urgent care? And the Connecticut Hospital Association is already weighing in, saying it's going to hurt community hospitals. Can somebody comment on that?
So, as you heard from Susan, there is such a thing called a facility fee that's commonly charged when a person gets care at a hospital campus. So that's been a long-standing practice. There's part of the bill for the professional service and then part of the bill to support the bricks and mortar of the hospital campus.
Is that like, say, Hartford Hospital and they have Hartford Health Care and you go to one of those facilities?
Well,
You're getting to the problem.
yeah, exactly. So, that has been a long-standing practice at a hospital facility. So big building. We recognize it's a hospital. You go there. There's an outpatient clinic or there's a lab. You get charged for the professional service and the facility fee. What's happened as hospitals have acquired more and more community services, what's happened is that those facility fees have begun to be tacked on to services that are not provided on the main hospital campus. So I might be across the street at a provider that is part of a larger healthcare system based on a hospital, but not on the hospital campus itself. So what the governor's bill does is propose to eliminate those off-campus facility fees. Whether or not that would impact community hospitals, it seems we certainly want to hear their concerns because as the governor and the comptroller and I have said, we all need to work together to solve this problem. So we want to hear their concerns, and we certainly want to support our independent community hospitals. They are not generally the ones with lots of off-campus sites, however, so I'm not seeing the problem right off the bat.
So, would you refresh our memory? Are those facilities outside their certificate of need process? Because, I'm sorry, go ahead.
No, you finish.
No, but there's been obviously questions about the efficacy of the certificate of need process. Some people complain sometimes it's too strict, sometimes it's been seen as too lenient. So when, and I don't mean to pick on Hartford Healthcare, but they're like Dunkin' Donuts. You see their signs everywhere, and so these facilities, let's say they're not a surgical center, but it's more they're putting their flag down in the Farmington Valley, whatever. Do they have to go to get a certificate, need certificate to do that?
No, not generally. So acquisition of a large physician practice under certain circumstances would require a certificate of need. Obviously, purchasing a hospital or mergers of hospitals requires a certificate of need. In other instances, it wouldn't be required. So it depends on the type of facility and the nature of the acquisition, of whether it goes through CON or not.
The hospitals, they have objected to a portion of the Senate bill that would peg out-of-network costs to Medicare rates.
Yep.
Would you address that?
Sure. So as I mentioned in my remarks, there's pretty good evidence both from modeling and from actual experience that capping out-of-network costs at some defined cap does two things. It encourages providers to stay in network, which benefits everybody, right? The governor talked about, wanting to be able to go to the provider with the best value, and if that provider's not in network, that's a lot more difficult. So keeping providers in network is a general good. We also have seen that it drives down the in-network costs in addition to keeping the out-of-network costs low because it changes the dynamic between the insurer and the provider when they're negotiating their contracts. So I think the objection is to the governor's proposal starts at 100% of Medicare, and there's an objection to that number. I think we need to engage in conversations to see what the right level is that will achieve the governor's goals and also, be a reasonable cap for out-of-network costs.
You had also mentioned at the beginning the transparency and, to create more competition. Not to pick on Hartford Healthcare, but as you know, St. Francis is now suing them for monopolizing and such. How would this legislation address that at all about being too powerful and fighting out other competitors?
So I'm not terribly familiar with the lawsuit itself, but let me just say what the legislation proposes. There are these so-called anti-competitive terms in some contracts between insurers and providers, and those anti-competitive terms make it more difficult for the insurer to do things like directing you to the high-value provider, to having a tiered network, to getting transparency about costs and quality. So the governor's proposing simply that those anti-competitive terms be banned in contracts between insurers and providers.
You mentioned the $400 million in facility fees. Is that an annual number?
That's an estimate, yes. Annually. Correct.
Doctor, it's not exactly on point, but what is your opinion about currently, as it's written, the efficacy of the certificate of need system?
So I'm 5 weeks into the job, but the evidence. Let's go with the evidence. The evidence is mixed on states with CON. It's clear that states that have a CON process have lower healthcare costs. That's an association. Do they have lower healthcare costs because they have CON, or do they have lower healthcare costs because of some other reason? It's not completely clear. But I will say, as somebody mentioned, this is a love it or hate it kind of a program, and there are certain people who feel like we need to do more review of acquisitions, and we need to be reviewing more mergers and acquisitions in healthcare to limit some of these anti-competitive practices. And then there are those who feel that it's intrusive. So I think we need to work together to strike the right balance, make sure that we are being prompt in our CON reviews, and I'm committed to that, and that we're reviewing the appropriate types of healthcare transactions and not those that don't need to be reviewed.
So you can't eliminate these costs, but you're trying to rein them in.
Which costs are you talking about?
A multitude, whether it's pharmaceutical, whether, whatever.
As I mentioned, and the governor mentioned, this is a very, very, very complex set of problems. So that's why he's proposing to come at it from multiple different directions, and that's why we have to sort of chip away at the problem one step at a time. There's no single solution.
Can I add a little bit on the CON? I'll just add a couple of thoughts on CON. If you look at the rural parts of our state, some of the larger healthcare systems have taken over the smaller hospitals, and they've taken the services away. For example, women's health is pretty much getting reduced in many hospitals across the state. The CON is a protection for that. And 3-4 years ago, when this was not as clearly happening, I would have given you a different answer. But now I'm going to say that CON is needed, because as soon as you're taking away healthcare from a community, you need the state to step in and say, no, you can't do that, because there are community members who are going to be hurt by the larger hospital system's decision.
Governor, would you put this proposal into the larger context of your ambitions that I guess you first articulated when you moved Dr. Gifford over to OHS? As far as when you made that move, you expressed some desire to have a more holistic view of healthcare strategy for cost and as well as quality.
I did. I thought expand the role of Deirdre in the Office of Healthcare Strategy. I wanted to make sure that we've got a lot of different pieces. We've got the Controller's Office working on things. We've got different groups. And I thought having a strategy statewide where we can work together as one made the most sense. And that's why Deirdre's taking the lead there.
And is this an outgrowth of that?
Absolutely. I mean, what we're able to do, what Sean's able to do for state employees, we want to be able to take that to the rest of the state, what we can do in terms of transparency, and provide that discount card for everybody in our state. Thanks, everybody.
Thank you, Zach.
going to ask you to explain to your younger staff who the hell Dr. Kildare was.
I was looking at you when I said that.
Don't rub it in.
I could have said Marcus Welby.
I remember that too.
A few of us do, Sarah.